And if you believe with me, rise on your feet and let's sing together. Yo, 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 yo.
Good morning, good afternoon, and good evening to you all. I would like to welcome you to the Africa Cafe 3 of the 2023 PATA Summit. The day's summit theme relates to the comprehensive package of care and service integration, specifically to accelerating progress towards the fourth 90 for children and adolescents. This session on the journey of disclosure uncovers the multifaceted world of disclosure, its impact on children and young people affected by HIV, and celebrates real stories and innovation from the front line. Our speakers will take us through the process of disclosure, its various types, and the crucial connection to the fourth 90, that is improving the quality of life of children and adolescents that are living with HIV. This session also goes beyond theory and also shares authentic experiences and innovative strategies for tackling disclosure for different age groups, bringing the unique perspectives from young people, caregivers, peer supporters, and experts. To start us off, our first presenter will be Dr. Martha Makamineka. Dr. Martha is a senior Rwandan pediatrician, clinician, and public health specialist. For the past 7 years, she has been working with Elizabeth Glacier Pediatric AIDS Foundation in different capacities, where she has been providing or continues to provide technical and health program leadership, technical implementation of integrated HIV and capacity building in several countries in Africa. She currently serves as the Associate Director and of Adolescent Services for Elizabeth Glacier Pediatric AIDS Foundation, and she's based in Kigali. Welcome, Doctor. Dr. Makamineka will discuss the contribution of the disclosure to the fourth 90. She will also discuss the different types of disclosure, existing tools, and provide an overview of the best practices and key lessons. Dr. Makaminega, over to you. Thank you.
Good morning, good afternoon. My name is Martha Makaminega. I'm the Associate Director for Pediatric and Adolescent Services at the Elizabeth Glaser Pediatric AIDS Foundation. Very happy to be a part of this conversation where I will be talking about disclosure. What is disclosure? Disclosure of HIV status is referring to someone that they or someone else is living with HIV. And disclosure of HIV status is not an one-time event, but rather a process. Disclosure of perinatally acquired HIV status involves ongoing discussions about the disease as the child or the adolescent matures cognitively, socially, emotionally, and sexually. When it comes to types of disclosure, we have mainly full disclosure, where we provide full information and knowledge about HIV and one's HIV status. We can also have complete non-disclosure, which is maintaining complete secrecy around diagnosis, not telling the truth or not providing any information about the diagnosis. We can also have accidental disclosure and deception. There are a number of disclosure practices. I will mention few of them. The healthcare worker engagement in disclosure can vary and have disclosure by healthcare worker, supporting caregivers in disclose at home, assisted disclosure by caregiver with healthcare worker, counselor support, supporting adolescent disclosure to caregiver or partner, assisted disclosure by adolescent to the caregiver or to the partner with healthcare worker or counselor support. Now, disclosing HIV status can be in the perinatal HIV or in adolescent. In perinatal HIV, I want to highlight the major factors that influence disclosure and the major barriers. The factors influencing disclosure are mainly the child's age, the child's perceived ability to understand HIV infection, caregivers' education level, caregivers' openness about their own HIV status. Now, the major common barriers are the fear the child will disclose HIV status to others, fear of stigma, concern for the children's emotional or physical health. As I had mentioned, disclosing HIV in adolescent is quite different from the perinatal period. When it comes to adolescent, I want to highlight few points that are really, really important. And one of them is the 5 C's. The 5 C's that must really be respected when disclosure, when disclosing HIV in adolescent is concerned. It's the consent, the confidentiality, the counseling, correct, and care. When disclosing HIV in adolescent, it is also important supporting the adolescent and encourage them to get parent and caregiver support when feasible. It is also important to mention that disclosure needs to address the adolescent health needs and provide anticipatory and preventive care to address aspects of their health, including sexual and reproductive health. It will also be really important to support adolescents in disclosing their HIV status to caregiver and family, to friends, social network, school, work, and also the partner. There are a number of barriers, particularly at a household and community level when it comes to disclosure. It's mainly guilt and concern about being rejected, belief that the child or adolescent may not be able to keep the information private, and the need to protect the child or adolescent and their family from stigma and rejection. Barriers are also related to discomfort among parents or family around disclosing an HIV status to their child and adolescent, the desire to preserve innocence and childhood and belief that the child or adolescent is not ready or is too young, the concern for the child and adolescent emotional and physical health following the disclosure, and the fear of adverse consequences. There are also benefits of a disclosure, and the benefits are for the child and the young person, and those benefits include feeling more in control of their health and body, open involvement in their medical decisions, better access to health education, improved psychosocial well-being and mental health, and better school focus and performance. Those benefits are also for parents and caregivers, and they include relief because no need to maintain secrecy, ability to talk openly about the condition of the child and others, and to provide support to the child. They include also better treatment support for the child and adolescent at school and doing changes in care, and potentially fewer behavior problems with the child or adolescent. Those benefits are also for patients and caregivers, and they include they provide developmentally appropriate and truthful explanation of the disease, validate the child's and adolescent concerns for the unknown or fear for worse diagnosis, clarifies misconceptions about HIV, and prepare the child or adolescent to deal with stigma, and provides ongoing support and openness to plan for life with HIV in a productive way. Last but not least, there are also benefits for healthcare workers with the capacity to talk openly about HIV and treatment with patients, capacity to deliver sexual reproductive health education and offer services such as PrEP to partners of sexually active adolescents living with HIV, capacity to provide more effective psychosocial support services and referrals. Thank you.
Okay, thank you, Doc, for a very enlightening presentation on disclosure, its benefits, and how it can contribute to the 490 and key issues to consider when implementing disclosure interventions. And again, thank you, participants, for staying with us. If you have got any questions, please feel free to jot down your questions in the chat box. And then also, just in case we don't have enough time to answer all the questions, you can also put your email address next to your name in case, so that the experts on our panel today can send you answers after the session. So going on to our next presenter, we're going to have a presentation or a video from that was moderated by Dr. Brian Zanoni. Dr. Brian Zanoni is a distinguished medical professional, and he's also an associate professor at Emory University, and he's very committed to public health as he's a specialist in this field. Dr. Zanoni, over to you.
Hello, everyone. I'm Brian Zanoni, Associate Professor at Emory University in the United States. Today, we're going to be talking to 3 young people as we travel and follow their stories through their path of HIV disclosure, the process of learning about living with HIV, and the impact that has had on their lives. Health providers play a critical role in improving adherence through supporting positive disclosure experiences. But let's hear from young people today about how health providers can support this important process and have a positive impact on the lives of people living with HIV. So I'll let our panelists today introduce themselves.
My name is Ruta, based in Uganda, working with Baylor College of Medicine.
Hi everyone, my name is Ntokozo Mkize and I'm from South Africa. I'm a young person who's living a positive life and who works with young people in South Africa, more especially in township and community. I work as a peer educator.
Hi everybody, my name is Aziwe and my surname is Mkungegwana. I'm 24 and I'm from South Africa in Durban, and I've worked with different kinds of organizations, working with the youth, facilitating, assisting in disclosing. Yeah, I've just been involved in communities and working with different organizations.
I am the founder of an organization called Ikusasa Ngelami. We provide early intervention and prevention programs, and we couple that with parenting programs on holistic development practices that young people and parents can use to develop themselves holistically.
Great. All right. So I think that's everyone on the panel. So we can get started with our first question. I think it's for Nkozo. If this is something you're comfortable with sharing, can you please tell us about your disclosure journey?
My journey was not easy, but I already prepared myself and tell myself, if this is what I have to do to make sure that I have a healthy life, I need to take my medication on time. Disclosure, it's not for everyone, but you need to prepare yourself if you are willing to disclose to someone or to everyone, maybe at home or anywhere, but you need to prepare yourself for disclosure. For me, it wasn't easy. And remember me, my story, I started taking the medication without knowing what the medication was. I started taking my medication when I was 8 years. I started taking them without knowing what is the medication for. I started to know what the medication was. It was very hard for me to accept that situation at that time. But when the times goes on, I joined, a youth care club, a support group back in my community where I was raised. So when I started to join the support group and meeting other young people, and then we talk about the same issues that we have. So that's where I started to tell myself, it's very important for me to adhere to my medication. And another thing for others, it's very important for them to know who are they disclosing to, why are they disclosing, and then where are they disclosing, so that person that you want to disclose your status to. And you need to prepare yourself about their reactions towards about you telling them about your HIV status, So you need to prepare yourself about how are they going to react. For me, it was all about myself. For me, disclosing about my status, it was not about what other person is going to say about me. It was about me sharing my story and then also assisting that person in that little corner to know that whatever that you're going through, but you will find a way to make it. It's not easy to disclose, but not everyone is going to be like Ntokozo and share their status in the world or in the community. But you need to understand in your little corner, there is a life after being HIV positive. And it's very important to disclose because you know you are not carrying this burden on your own. You have somebody who's supporting you on the side, and you need to trust that person we are disclosing to, because not everyone will accept you who you are, but you need to have a trust and a bond to that person that you're disclosing to. And it's very important to know why are you disclosing? Is it going to help you or is going to help another person? To me, it was all about it was going to help me, and at the same time, it was going to help other people about understanding the importance of taking your medication and seeing other people who are on medication and who are adhering very well to their medication. So it's very important to disclose. Also, you as a person who is disclosing, to get a disclosure and accept your situation and accept impilo oyiyona, and also understand ukuthi whatever happens, it's you and your medication. Thank you. I hope that is clear. That's make it clear.
Great. Aziwe, are you able to share your disclosure journey?
So in a nutshell, I was born with HIV, and as I said, and I'm 24 years old. And I started taking my medication in 2009. I was also 8. I was 9. It's not easy. It's never easy when your status is being disclosed to you, because same situation with Dogozo. I was on medication for years, but not knowing why I was on medication and what was the medication for, until I was 14 years old. That's when I was told my status. Obviously, I didn't ask. I never asked my mother. I never asked her because I think I was afraid of the answer, or maybe I was just not ready to know. But obviously, when I would be like in my own space, I would think as to what is this medication for, you know? But one particular day, we went to the doctor just for a checkup appointment, and the doctor, in the presence of my mother, asked me, do I know why I take this medication? And I said no, and she told me. Not knowing and knowing something, those are two different things, because now I know, and it's either when someone discloses your status to you, it's either you're going to be motivated to take your medication and be like, okay, now I know what's this medication for. I need to make sure that I take them on time. I need to make sure that I'm always there for my doctor's appointments and all that. Or you're going to be demotivated. You're going to be angry. You're not going to want to take your medication. You're going to be angry at your parents or at yourself. It's either or. But for me, it was a matter of being motivated and saying, okay, you know what? I'm going to take my medication. I'm not going to allow HIV to define me or control my life. Moving forward, it's just being determined, and obviously having to first accept myself before telling a friend or telling anyone, or maybe a partner when you have grown, obviously. So yeah, it's another journey. In order for you to be able to disclose to someone or a friend, you first have to accept yourself. So the self-acceptance journey goes along with being able to disclose. So I had to first accept myself in order to stand in front of a crowd or like be able to disclose to a friend. I first had to say, Aziwe, you are okay, you're not any different. HIV is something that you have to live with, but it's not who you are. And it's very important for caregivers to have the boldness, you know, to be able to tell and disclose the status, the HIV status of their kids to them, obviously when they're a bit grown and mature enough to handle the news. When I spoke to my mother and I asked her, just being curious, Mom, why didn't you tell me? And she said, I was scared to tell you. I think she had blamed herself, you know, because I was born with it. And so she also she didn't have the courage to tell me. So caregivers also, shame, need the support they need. They need to be given the support and the strength to be able to be able to disclose statuses to their children. But it's never easy, especially now I'm a young person and you have to disclose to your partner, it comes with a lot of rejection, but you have to be ready for that. You have to be ready for that. And really having to disclose your status to someone that you love or care about, and you think, you know what, they deserve to know, or I just want them to know. The reaction is not really on you. It's never on you. It's on them. So yeah, you just have to be ready for anything once you disclose HIV status to someone.
Great, thank you for sharing that. I just wanted to switch to Zonky now. As a caregiver, can you tell us your experience with disclosure?
I'm really touched. I think I still have a very fresh emotional wound. I lost a relative. Let me say a relative, due to HIV related sicknesses. She passed on in May. She disclosed when she was very close to being sick. When she disclosed, I did everything in my power to help her. In actual fact, working with young people, I was in journalism before I joined child and youth care. So when I was starting to pay attention to child and youth care programs, I started writing early intervention articles as a column. So one year before I qualified as a child and youth care practitioner, I looked into disclosure and issues of disclosure using an article space where I was writing in one of the newspapers here in South Africa, Isolezwe. And a young person picked up that article and he wrote to me on my Facebook page, because I would have my Facebook page. He wrote to me to say he's HIV positive and he's going through some of what I had written on the article. And he asked how he could get a hold of me. And when he disclosed to me for the first time, I helped him to go to the clinic and he was fine. He studied, he carried on with his life, and we still connected. So when my relative came to me, I felt I was ready. I knew how to help her. I knew what to say. So I do believe with this information that the two young ladies have shared, she wasn't ready. And I'm still asking myself as a caregiver, what more could I have done? And having gone through the mental health month and listening and raising awareness on mental health, I do believe that she was not in the right mental state to disclose or to face her situation. And unfortunately, at that time, she had gone very ill. We took her to hospital. I spoke to her. We took her to counseling, and she kept promising that she, in actual fact, should be turning 24 in October. She kept promising that she's taking her medication. Unfortunately, I don't live with her, so I was taking care of her in my house. I'm married. I'm living in another area. Her health disintegrated to a point where she eventually passed on. So my hurt is that I do ask myself every day, I even said that to my counselor, that I really wish I'd known what else I could have done, because we took her for medication, but she just refused to take medication until she developed other complications, which was TB and MDR, and then she passed on.
Thank you very much for sharing that. I'm going to switch gears and speak to Ruta. So Ruta, as a peer supporter, how are you approached to assist with disclosure support?
First and foremost, it is really hard, as I myself, someone who is HIV positive and disclosed at a very young age. So when I find my AYPs, they're talking about disclosure. Disclosure is, as I said, it's a wide field. One can have disclosure to a partner, disclosure to a parent, or maybe disclosure to a whole huge group, like just now we're doing right now. try my best to advise my AYPs on how best to go about it. When is the right time to disclose? And do you really feel that you really need to disclose? If you are to disclose, are you ready for the positive answers and negative answers, or maybe feedbacks that you're going to get? I've helped quite a huge group of young people living with HIV in disclosing. Yeah, it's quite challenging. I think they have a lot of expectations when they do this disclosure. The best way to go about it is encouraging them, first of all, through adherence. As we normally say, right time, we have 5 R's, right time, right place, right person, right dosage, right frequency. For you to be able to disclose, you know, for us here in Uganda, if someone discloses and finds out maybe this person is positive, first thing that comes up in their mind is practicing suicide. So at least the best we start off with is adherence. Make sure you take your medicine in the right time. And then top of that, socializing with different people, with their fellow young peers, then plus me. So you really need to, you know, keep pushing through. Yeah, that's the best way we start off. Then we head bump with disclosure.
What support have you had or collaboration with healthcare providers?
One, I have, for example, linking them up with youth networks, working hand in hand with health providers, doing follow-ups. As peer supporters, we are linked up with so many young people. So doing follow-ups, that falls also once in DSDM. Giving them, since I don't have all the full knowledge once it comes to health, so we work hand in hand with our doctors, the health caregivers, educate them, counselors. Basically, we even build them when it comes to life skills, training, manuals, a huge or maybe platform to speak to more adolescent. And for example, what PATA does when we have such like summit meetings, it really encourages them to even do more and, you know, disclose and even help others.
Great. Thank you all for sharing. Those were some incredibly powerful stories. I think it's really helpful to hear kind of the collective effort required in the journey of disclosure and how the key roles that everyone plays, including healthcare providers, peer supporters, caregivers, are all required to help, you know, guide adolescents and youth, and children through their disclosure journeys. So thank you all for sharing.
Thank you, Dr. Zanoni, and also thank you to all the young people and also to Zongwe from Ikusasa Ngelami for sharing their journey of disclosure and also their very intimate experiences of disclosure. We really appreciate the sharing, and also you know, in the Q&A, there's a lot of applauding of these young people that have shared these stories, just to relay that to them because they're also watching. Yeah, we are going to go to our next presenter, who is Mrs. Nokuthula Heath from Zoe Life. Nokuthula is the project manager for maternal and child health at Zoe Life, and she works for the organization that is scaling up disclosure programs and guidelines across South Africa and also in the region. Over to you, Nokuthula. Thank you.
Hi, everyone. My name is Nokuthula Heath, and I work for the organization called Zoe Life, and we are based in South Africa. Today, I will be taking you through the Scouting for Innovations and Solutions. I will be taking you through the process and the journey of rolling out the disclosure guidelines in South Africa. The first slide that I would like us to look into is what were the gaps that we identified. So, as you know, studies show that children and adolescents in South Africa have low rates of HIV disclosure. These were some of the gaps that we identified. age-appropriate communication. Healthcare workers must tailor their communication to the child's or adolescent's age and developmental level, of which it becomes a challenge. Emotional impact. Healthcare workers, they are also faced with providing emotional support, address fears and anxieties, and help patients cope with their feelings. Legal and ethical considerations. Healthcare workers need to be aware of legal and ethical consideration depending on the local regulations. Parental involvement, of which is a huge challenge. Deciding when and how to involve parents or guardians in the disclosure process can be complex. Healthcare workers, they also need to navigate the legal and ethical aspects of disclosure while respecting the child's autonomy. Lack of resources and tools. Healthcare workers have limited access to correct resources and tools needed to support the disclosure process. So after identifying these gaps, what is this that we did to support the rollout? The first thing that we looked into how do I address the gaps with knowledge? So we developed a model of disclosure of which it's a package that equips healthcare workers with confidence, with skills and knowledge and a framework to support caregivers through the barriers and the journey to disclosure in an age-appropriate, child-focused method. And in this package, it's comprised of 4 modules. We look into foundations of working with children, HTS, disclosure, and adherence. And through this course, the healthcare workers or the frontline workers, they will receive job aids that they are able to utilize when they're providing the services. We have the paper-based one, we have a digitized one, and they also received a step-by-step guide. And in that step-by-step guide, they've got access into an algorithm for disclosure process. They've got all the assessment tools. They've got disclosure plans, including a register that they can use to track the disclosure process. And also as part of the package, it also includes the SOP, of which is also included in the South African adherence guideline package. And these are some of the examples of which, for the purpose of today, I would really like to zoom into the disclosure step-by-step guide. So it is a printed pediatric and adolescent HIV disclosure tool for healthcare workers. It's really a quick pocket guide that can be used during consultation. So these are some of the pillars that the healthcare workers, they can, when they use the step-by-step guide, they can be able to look into things like pre-disclosure assessment of the caregiver. What is required? What are the things that they need to consider? It will take them step-by-step how to follow that algorithm. The second part will be disclosure plan with the caregiver and the healthcare worker. Who discloses, when, how, and what words to use. And all this information will be in the book that the healthcare worker will use to guide the process. And also, if you look on number 3, disclosure to the child. This is where now the healthcare worker have worked with the caregiver, and now the caregiver is ready to disclose into the child. How will the session look like? And you'll see on the next slide what I've done. I've actually extracted the exact pages from the step-by-step guide. As you can see, there's different algorithms, and it's up to the healthcare worker to decide on that day what is it they need to focus on. You'll see there is an algorithm that speaks into legal consideration. There's an algorithm that speaks into a pre-disclosure. I mean, if you can see there's even a dashboard that preps the healthcare workers to say, is the caregiver ready? It's a green. Is the caregiver needs some support? That will be your amber, your orange, or the caregiver really, they're not ready, and then that will be red. And there's also information on post-disclosure support messaging. Now, let's talk briefly around the challenges that we were faced with in rolling out the disclosure. The first thing was budgets, limited budget and funding. limited funding available for training, for printing, and also for disseminating the policies. Funding was also not available for support, supervision, and mentorship, and also limited funding for printing high quality job aids aimed at children and adolescents. The second one was poor buy-in from gatekeepers, making advocacy for resources to roll out disclosure intervention difficult to mobilize. The third one, we're looking into high attrition and retention of trained healthcare workers, high staff rotation, other job opportunities, and lack of structured skills transfer. And the last one also was monitoring and evaluation, specifically having access into a standardized documentation to longitudinally capture disclosure progress. On my last slide, we're gonna look into what are some of the best practices and what have we learned through this implementation. Number one, training is important. Training is key. Through training, the healthcare workers, they were able to introduce disclosure to their caregivers. They were able to identify complex disclosure cases. They were able to provide structured disclosure services to children and adolescents living with HIV, especially the ones that we had not been disclosed to. They were able to provide disclosure services to children and adolescents within an ethical framework. Number two, case conferencing. One of the very, very powerful tool was to get the healthcare workers that have attended the training to start conducting case conferencing where they were working. And we use this as part of the post-training mentorship. And they were using this platform where they were also sharing their real life cases. And through that, they were able to receive input from experts and their peers. The third one, standard operating procedures. Healthcare workers having access to correct policies, tools, documentation, and referral networks, and also being able to have access into the step-by-step guide of which they really, when they gave us feedback, they said, this is the quick pocket guide. We are able to grab it and we are able to actually go through it and quickly get the information that we need. And the last one, we need our healthy frontline workers. We need healthy body, healthy mind, and healthy soul. So this was one of the things that came up through supported supervision, where they've said, they really need a space where they can be able to debrief. So bi-weekly debriefing sessions with their peers. If there is a way to have access to trauma counseling and also promoting self-care for our healthcare workers. And I think with the environment where we found our healthcare workers working in where there's not much resources, but whatever the resources that we have, we need to create a conducive working environment. So that was my last slide. I would like to say thank you to everyone. If you need more information, I've got my details on the slide. Thank you.
Thank you, Nokuthula, for a very informative presentation on rolling out disclosure guidelines and also on the disclosure step-by-step guide, which I think is a very, very innovative solution to some of the disclosure challenges in terms of healthcare provider capacity and facilities. And thank you to all our presenters today. This was our last presentation. And our next segment now is where we are going to take some of the Q&A questions. We've got our panel of presenters. They're here with us today, and they're going to share. They're going to take some of your questions. There's quite a lot of conversation in the chat around disclosure, and that shows that this is a very important topic, and it's also a very wicked problem in all our facilities where we are having those challenges with addressing disclosure and how it can be done, when it can be done, who can do it, and so on. So may we please also have our panelists, and to our panelists, I think we only have time for one question each. So I will select a few from here, and I'm going to start with the first question is for Dr. Mukaminega. So the first question is, are there legal procedures available for caregivers who totally refuse to initiate disclosure and become hostile when the topic is brought up by the healthcare worker? In case of accidental disclosure to a child that has come unaccompanied to the facility. For example, the child decides to join a health talk session and learns accidentally that he or she has HIV. How best do we handle the post-disclosure trauma and offer emotional support? Thank you.
Yeah, thank you, Dr. Chipo. Do you hear me?
Yes, thank you.
Thank you. And thank you for the question. Yeah, talking about the legal measure, when it comes to disclosure, it is always better to support the disclosure process rather than jumping to legal measures. Why am I saying this? As I have described, you know, caregivers, parents, they're afraid of disclosing to their child, their adolescent, because they tell themselves that maybe once my child is disclosed, how will he behave? How will we manage the stigma? So rather than thinking first of legal measures, my advice would be to really support that caregiver. Support the caregiver, focusing on the benefits, because most of the time that caregiver is not aware of the benefits the child, the parent, the school will get out of disclosure. So and in my experience, I have had an opportunity to participate in the disclosure process. Once the parent, the caregiver, learns and is comfortable that once supported, what the disclosure is managed properly, then close to 100%, they will accept to be accompanied and get the child disclosed. So my response, based on what I have seen in my practice and what we know, is that really support, and support. Support the caregiver, support the parents to be comfortable with the disclosure rather than thinking of legal measure. Now, once a child is accidentally disclosed, it's a very difficult situation. At a pediatric clinic, I have witnessed cases of accidental disclosure. It's a very painful experience. It's a very difficult situation to manage. However, it is manageable. It is manageable. That child will have to be supported not only by the healthcare workers and the counselors, but also bring in the caregiver and the parents and the peer educators. So that child who has been accidentally disclosed will need more support compared to other children. But again, difficult situation, but once well managed, that child will overcome the trauma and then be a child who can live positively his or her HIV status, and become a good student, a good citizen. Thank you.
Thank you, Doctor. Our next question is for Nokuthula. Nokuthula, there are questions around the attrition of healthcare workers that you mentioned in your presentation. The question is, what measures have been put in place to minimize high attrition and retention of healthcare workers? And this question is from Emma from Cameroon. Thank you.
Hi, Chipo. Yes, thank you for the question. It is a difficult question to actually answer, but what I can say, what we've learned from our experience is that when an individual has been capacitated, it's very important that when they go back into the workplace, number one, they need to make sure that they orientate everyone in the workplace where they are working. And the second part is to actually look into skills transfer. When someone has been trained and then when they implement, it's very important that they actually educate their peers on what they've learned. Because I think the honest truth is, I mean, there are job opportunities. We can't hold someone to say, you know, you can't take an opportunity, but we can put measures in place how we actually retain knowledge that have been learned. Thank you.
Thanks, Nokuthula. I think that's very interesting. Retaining knowledge after training. I think that is something that we can learn from Zoe Life in terms of you know, how after training the people that you train, you expect them to also orientate others. Okay, so the next question is for Dr. Zanoni. So in your work, when you are working with adolescents, it seems adolescents are struggling with many issues with regards to disclosure. How best can peer supporters be capacitated to have conversations with other young people? Thank you.
Yeah, that's a great question. I think you know, peer support is very important during this time frame, and you know that support can come in many different ways. One, in helping them disclose to others and helping them guide those conversations, but just really being there for them. You know, another thing that is often quite helpful is connecting to other adolescents who are also living with HIV, so that the adolescents feel that they're you know, not alone in the world, that there are many other people just like them that are dealing with their same issues. So peer supporters who are also living with HIV and sharing their own disclosing their own status with others are often quite helpful, because they're you know, a shoulder, you know, a person, an ear to listen to, a shoulder to lean on, and ask questions. And so I think really the main thing is really just being there for adolescents, showing them that you know they're loved, they're cared for, status doesn't really mean anything, and that there's many people like them dealing with their same issues. As an adolescent, it's really important to, you know, feel like you belong, and I think having a peer supporter that is supportive of you and believes in you, and is there for you, really adds to that feeling of belonging. And so I think that's one of the main key points to being a good peer supporter.
Thanks, Brian. Yes, I really do agree with you that having a near peer or a peer listening to you can also help make the process smooth and also have that sense of belonging. Okay, so the next question, because we still have a little bit of time, maybe Nokuthula, there's a question around some clarity around how you do or conduct case conferencing in facilities. Thank you.
Okay, thank you, Chipo. So from our, just drawing from our experience, so we have used a WhatsApp platform as well, where we start a group with trained healthcare workers, and then they are able to discuss cases. Obviously, we don't compromise confidentiality. So they are able to post a case that they are having difficulties with, and then what do? We don't respond. We let other peers who also receive the training to respond into that case, and then at the end we consolidate all the recommendations. So that's one platform that we've used. We also used the morning sessions at the facilities, where when they start in the morning, they do like a roll call, and then they allocate people. And then we also use that opportunity to kind of like touch base, you know, with healthcare workers. And then we are also able to discuss difficult cases, and we are also able to provide like an in-service training if there's a need. And we also used Fridays, afternoons. They seem to be days that are more quieter in the afternoon. And then we also use those days to actually do like an in-person. So we use an in-person, and then we also use a WhatsApp. So yeah, it is a hybrid approach. Thank you.
Okay, thank you, Nokuthula. I think that is very clear how you conduct your case conferencing. And back to you, Dr. Zanoni. It seems there's a question here around mental health. The question says, mental health is a big predictor of young people's willingness to disclose to their status. Do disclosure programs also provide mental health support for young people who are grappling with disclosure?
Yeah, I think they should, and mental health is really a key. And some of my research has shown that the earlier a child is disclosed to of their own status, particularly ones born with HIV, the better off they do in terms of mental health. So having access to counselors, social workers, mental health providers is key to success as an adolescent. Not just those with HIV, but all adolescents should have access to that. And hopefully programs have access to that. I know a lot of places there's not necessarily psychologists or psychiatrists, but there's access to social workers who often play that role. And then we often use, depending on what sort of they need, a lot of just times the counseling is just an ear to listen to, and sometimes peer supporters can take up that role if there's an absence of mental health providers, and having somebody there to give advice and things like that. So absolutely, mental health is a key part of disclosure. I know in many African settings, there's not a lot of access to healthcare providers with mental health experience, such as psychologists and psychiatrists. But there are a lot of task shifting where counselors and social workers have taken up a lot of those duties.
And thank you for that, Dr. Zanoni. And that brings me back to the video that we watched where Zonke was saying that was talking about being a caregiver and needing support. Is there, I'm just asking all of you, is there any interventions, particularly or specific activities for caregivers that are available that can help support them come to terms with their status or the status of their children, such that they can be able to disclose or be willing to disclose? Maybe I can start with Dr. Martha, and then Nokuthula, and lastly yourself, Dr. Brian.
Yeah, thank you, Dr. Chipo. When it comes to the appropriate, appropriate age of disclosure, I want to say that I want to agree with Brian that the earlier the better. But I also wanted to share that in many countries, the guidelines for the management of HIV include different age, whereby the partial disclosure should be started or completed, and then the age of full disclosure. And I can just give some examples. For example, in Cameroon, the partial disclosure, it is advised to start around 7-11 and then complete between 12 and 13. For Uganda, the partial 8 to 10, and then complete the disclosure process by 12 years. And then Kenya, different countries have included that guidance in their guidelines. So which has, to me, has helped or guided the counselors and whoever is guiding and leading the process, the disclosure process. Thank you.
Thanks, Dr. Martha. And Nokuthula? And Nokuthula, regarding caregiver support?
Yeah. So from our context, so we do have support groups for caregivers that are looking after HIV positive children, where they receive structured sessions to provide them with support. And then also we just developed a tool, we call it Caregiver Connect. It's on a WhatsApp platform, of which we already have pre-populated topics where we look into HIV basics, information around medicine, adherence, disclosure, how to talk to your child, and also some material that they can also read for extra support. So when they come into the facility, we give them the number, and then we enroll them into a WhatsApp, and then at their own leisure at home, they can tap into the WhatsApp, and then they can press hi, and then it pulls up a long list of menu with all the topics, and then they can click on what they need to learn, and then it's either it comes in a PDF format where they can read the information, or it's we also have like short videos. So that's the support that we have for our caregivers. For our context, it's been translated into local languages as well. Thank you.
Okay, thank you. I think we've come to the end of our session. We've run out of time, but there's still so many questions in our Q&A. We really appreciate the questions, and also it just shows us that disclosure is a very important public health issue that we need to address, and also come up with innovative ways to maneuver as healthcare providers, as NGOs that are working in the space, as government departments and other stakeholders that are important in making sure that the disclosure process is done and also done in an effective manner. So in closing, I was wondering if the panel can just give us one takeaway, and then we can close our session. We'll start with Nokuthula, because we can already see you. Thank you.
Okay, so I think for me, what I can share is that I think we need to look after each other as frontline workers. And I think, yeah, I think we really need to support each other. For me, I think that's a takeaway message.
Nokuthula. And Dr. Martha?
Yeah, thank you, Doctor. So to me, the main takeaway message is that though disclosure can be difficult to handle because HIV for a child and adolescent is obviously difficult to manage, but it is possible. Disclosure has so many benefits. So that should give us, health workers, caregivers, peers, the courage to look for information and be equipped to support disclosure, because once the child, the adolescent, the youth is disclosed, knows the HIV status, there is so many benefits, and we have to do it right and now. Thank you.
Thank you. Doing it right, doing it now, and doing it together. Thank you for that. And Dr. Brian, Dr. Brian, please.
Yeah, I mean, I agree with everything that was said. I would just add that, starting the process as early as possible, and that it's a process that it starts through. There were a lot of questions in the chat about what do you do if the caregivers don't want to disclose or they refuse to disclose. As Dr. Makaminga also mentioned, it's very rare in my experience that a caregiver refuses to do it once you explain them that it's a process, that it's a slow process, and explaining all the benefits to the child. Once you do that, all those things go away. And I often try to find out what's the motivation for them not wanting to disclose, and then dispelling myths and things that people understand. So It's a process, but as also Dr. Minga mentioned, that it's a process that's multifaceted. It should involve the caregivers, the healthcare providers, and the adolescent, and all of that in a group should do it. And it's a process, and slow, but started early.
Thank you for that, Dr. Brian. And thank you everyone for participating, for listening, and for all these wonderful questions in the Q&A. The panelists will come back to you for those questions that we didn't get to today. And before we wrap up this session, please note that this Africa Cafe will be followed up by a disclosure workshop at all satellites, which will expand some of the issues we've discussed here. So I urge you all to participate fully and also get to learn a little bit more and more about disclosure. And yeah, thank you everyone, and goodbye.